title of this talk is Viral Transport, Survival and Transmission via Freshwater Ecosystems, Its Relevance to the Social Cost of Water Pollution. And I'd like to start with a couple of disclaimers, or one disclaimer and another kind of caution. And first, the disclaimer is that there really is no evidence that the SARS-CoV-2, the virus that causes COVID-19, can spread through people through water. And that's a quote directly from the CDC. But a quote from La Rosa et al. In 2012 suggests some care, and that is that among microorganisms, viruses are best fit to become emerging pathogens, since they, by mutation, recombination, and reassortment, can thus infect new hosts and adjust to new environments. This is a very different talk than I normally give. But this talk and a publication that's coming out pretty soon that came from the actually came out of the 2019 meeting try to respond to this benefit-cost paradox, which is stated by these sort of three sentences from a paper that's coming out in Nature Communications pretty soon. And that is that surface water is among Earth's most important resources, but when you do the benefit-cost studies they often report that the costs of water quality protection exceed its benefits. One really possible reason is that often only a narrow range of local water quality benefits are considered, so that the cost of keeping good water or fixing poor water sometimes appears to be bigger than single estimates of the value of things like beach closure or the cost of beach closure, sport fishing losses due to poor water quality, or hedonic land value costs due to degradation of water quality. The paper that I'm talking about came out of the paper called Protecting Local Water Quality as Global Benefits, came out of a conversation 2 years ago between me, Steve Pulaski, Steve Newbold, and Sheila Olmstead. The purpose was really to integrate global climate change costs of eutrophication-induced methane emissions from lakes into the sum of the costs of poor water quality, basically because they increase due to eutrophication. The question is, if we begin to sum enough of these different costs, do those then become greater than the cost of keeping good water or fixing poor water quality? That paper shows really a few simple things, and that is that the global atmospheric present value of eutrophication is very large, ranging in the trillions of dollars to 2050. And this depends on the growth of eutrophication and the discount rate, whether it's somewhere around 8 trillion or $81 trillion. A case study of Lake Erie compared then single local versus global methane costs, single local recreational values or costs versus global methane costs, and found generally that when you do those comparisons, the methane costs globally of Lake Erie's emission of methane due to eutrophication is about an order of magnitude larger than the local single recreational value due to fishing or perhaps to beach closure. So where did this talk come from then? It came really out of the paper Protecting Local Water Quality as Global Benefits. There are two key sentences that I think were written by Sheila Olmstead. The first one is, given that the full gamut of potential damages is difficult to monetize, a comprehensive estimate of the non-climate damages from eutrophication and harmful algal blooms, especially if human health impacts are significant, could exceed our damage estimates for methane emissions. The accent here is that, or the suggestion is that human health impacts may in fact be very large. The implication of both of these sentences is that if health damages due to poor water quality are large, then the cost may be in fact co-equal with, or at least compete better with, the costs of improvement or protection of water quality. What brought my attention to viruses in specific was, well, the pandemic of 2020, for example. If anyone who was unaware of viruses and their important potential impacts on life, anyone who was not aware of that by now probably wasn't around at that time. But also, waterborne illness is not just a problem in developing nations, and it certainly is a huge problem in developing nations. But in the United States annually, some recent estimates sit right at around 3 billion dollars per year in cost to the United States due to the effect of waterborne disease. And also in 2020, the Lake Superior water tourism industry worried that COVID-19 beach fears would kill economic activity, and that a very important area for tourism in my region of the world. My office funded some science that found the SARS-CoV-2 virus was abundant at popular Lake Superior beaches, and Lake Superior is one of the purest lakes in the world. The mild model pepper virus, which is ubiquitous, I have found in prepared foods due to the spices that are put in them, and therefore ubiquitous in sewage, was also present, and they stayed there long into the autumn. Another thing that made me concerned about viruses in the waterborne sort of environment is that when Dorovich and co-workers in their looked at correlations between bacteria counts of swimmers and water recreationists, they found that there was really no correlation between those bacteria counts and swimming-associated occurrence of gastrointestinal illness. And gastrointestinal illness is, of course, one of the greatest impacts of waterborne illness. And also, a thing that brought my attention to viruses was that pathogenic viruses are not routinely analyzed. They can also form variants and do surprising and horrible things in very unexpected ways when we least expect it. So attention to viruses in the waterborne environment or the airborne environment are, I think, of concern. This is my premise. Many of us are really interested in the effect of nutrients on water quality, and normally what we think about is farm effluents go out into lakes and create algae. The algae then impairs recreation and other kinds of water uses. The other thing we know is that farms create food, food goes to people, people create feces, feces go into sewage systems and often are discharged into water, and also then there are nutrients in those feces that can generate algae and cyanobacteria that can impair uses of waterways in the inland water environment. In addition, the organic matter that comes from sewage can be harmful to drinking water sources, and the viruses, bacteria, and protozoa, and also the chemicals that are carried in that sewage can also cause harm to drinking water sources. But what I'm concerned about really today in this talk is the effect of all of this network on human health. And I think it's clear that the same pathway, I hope it's clear, that the same pathway of generation of nutrients also has the potential to generate pathogen delivery into aquatic systems, and those pathogens can cause illness and death. They can come through harmful algal blooms from lakes. They can also come directly into water and infect people. They can also come through drinking water sources. So the same pathways that are driving environmental impact of nutrients on water quality are also potentially driving waterborne illness that can be visited on those who are using those inland water sources. This is a somewhat inelegant view of how viruses, and this is specifically the SARS-CoV-2 virus that causes COVID-19, this is a little bit ugly, but it's a view of the transmission mode and a good model of waterborne transmission. That these viruses are created within people and defecated in large numbers into sewage systems, and the sewage system then delivers delivers these viruses into water after treatment, perhaps, and then those viruses are delivered eventually, or can be delivered to people, and those people can then take them in. And in the case of SARS-CoV-2, it has never been shown to be a major route, that is, that people have picked this up directly from water. Of course, anyone who's aware of how the pandemic has developed knows that it's the aerosols that come out of people that are the principal route of introducing the viruses into new infected people, but also the fomites, or that is to say surfaces on which those viruses are deposited, can lead to tactile transmission, and people can pick it up, which is why we are supposed to wear masks for the particles and and wash our hands very carefully when we touch various surfaces. The importance of microbes to water quality and recreational use was brought out to me very strongly about 20 years ago by some work I did along with Kathy Kling, Joe Harrigus, and Chris Azevedo, and me, and others were involved. But when we worked on Clear Lake, Iowa, Kling and Harrigus asked people gave people 100 importance points that they could assort among the seven different ecosystem attributes. And consistently in these kinds of analyses, what we find is that people first seek health, safety from bacterial or contamination, or in this case, simply illness, and they're more interested in that than they are even of water clarity, of water odor issues, of fish caught, fish diversity, and what the bottom feels like when you're swimming. So these the safety from illness is always close to the top of people's minds. So now I'd just like to do a quick run through of what I call aquatic virology for limnologists and economists. It could be a good primer for a lot of people. Just a reminder, because most of us know this already. Viruses work by gaining entry to the body via active tissues, things like mouth, nose, ears, eyes, other places. A virus enters specific cells and uses it to make copies of itself, and these are released via budding or cell death. Then they're shed in large numbers with feces, also shed in large numbers via the lungs, and so travel with water, and they travel with air. Some viruses are zoonotic, meaning that they can be harbored in other animals, usually vertebrate animals, and they can infect humans, usually via feces. Some important things about viruses to remember are that they can survive longer than bacteria in water, but may not always be infective. But if they're present and infective, then it can take very few to infect a person with those disease-causing organisms. They won't grow in water. They simply tend to decline in number over time as they inactivate, but they don't grow in water because they're specific to certain kinds of cells. They survive much longer in cold water than in warm water. And the survival of viruses, including things like the coronaviruses, is extended by organic matter presence and therefore polluted or eutrophic water. So again, eutrophication may be an issue for survival of viruses. And they're not very well killed by standard sewage treatment, nor are they well killed by drinking water treatment. That is, it takes more treatment to ensure that the viruses have been inactivated. And some of them are very susceptible to, some kinds of viruses are very susceptible to drinking water treatments, and some are not. And some are susceptible to ultraviolet light, and some are not. These viruses cause a wide range of illnesses and are difficult for medical practitioners to identify and associate with a source. And so often we talk about viral disease of unknown etiology, which means we don't know really where it came from. Here are some of the well-known waterborne viral pathogens. They are norovirus, enterovirus, they're hepatovirus, that is to say having to do with the liver, adenovirus, influenza virus. Coronaviruses will exist in waterborne situations, and not all coronaviruses are the SARS-CoV-2. They aren't even SARS, but there are coronaviruses that cause gastroenteritis and respiratory diseases, polyomaviruses, rotaviruses, papillomaviruses, and astroviruses. A lot of these will be waterborne and are capable of causing waterborne outbreaks. These cause a range of different kinds of illnesses, including, of course, gastroenteritis or stomach and intestinal inflammation that cause vomiting and diarrhea, but others can cause things like paralysis, mouth blisters, meningitis, respiratory disease, hand, foot, and mouth diseases, heart inflammation, heart anomalies, chest pains, diabetes, hepatitis, skin diseases, progressive brain inflammation, kidney malfunction, bladder hemorrhage, and cancers, and warts, cervical cancers, other cancers, and so on. So there, although probably the most common kind of viral waterborne disease causes a gastroenteritis or stomach and intestinal inflammation. The pathways to viral illness is via water from feces, is via water, but from feces. So the routes are fecal oral to the mouth, fecal nasal to the nose, fecal ocular to the eyes, fecal otic to the ears, fecal dermal to skin. And the oral route is probably the most likely because people will sometimes drink water that is untreated. There will be accidental ingestion while swimming, or oftentimes there's intentional ingestion of untreated water, like groundwater. In fact, viruses have been known to exist in large numbers in groundwater, which means their survival must be pretty long, or else the contamination is very direct between a groundwater drinking water source and something like a septic system. Fecal nasal transmission can occur by the aspiration of water, breathing aerosols and spray, ocular, water splashed in eyes, or aerosol contact. In the ears, swimmer's ear, which is a general term for a variety of different kinds of inflammations of the outer ear, happens when water enters ears, causing infection, or fecal dermal skin contact, but especially skin contact with where the skin is thin and kept moist, so in places where it is incredibly uncomfortable normally. The pathways for infection are illustrated here. Here we have an image of kids spitting out lake water. Also, there are aerosols that can be created by wave action. Anytime you see sort of foaming water, you're creating aerosols of some kind. So anything, these kinds of routes, immersion and aerosols, can transmit waterborne pathogens. Transport of viruses and other particles happens in a lot of ways. Anything that moves water can move the particles in it, and water transport of particles can happen by wave action and currents, but also in streams and rivers by current and water flow. Waterborne viruses may stay viable many days in water, which surprised me when I first looked into this literature. In the second column of this table, you see the number of days that viruses will stay detectable down to 0.1% of their initial number. And these are not in a few days, but many of them are quite long. There are other other characteristics of lakes, rivers, ponds, streams that will help the viruses exist longer in the system, and that is that if the temperature is cold, they tend to stay around longest. If there's lots of organic matter in sort of eutrophic or green or turbid water bodies, apparently that has some protective value. Viruses seem to not do very well at very high pH or very low pH, so are really survive or hang in, are inactivated most slowly at moderate, sort of middle pH, around neutral pHs, and freshwaters are best and high salinities are pretty hard on them. Waterborne viral illnesses are grossly underreported, and I think the literature is really clear on this. And there are lots of reasons for it, but the clinical signs of viral illness mimic other more common illnesses. For example, AGI or gastroenteritis that will cause sort of violent diarrhea and vomiting. Also, the time course of infection can be quite long, beyond a couple of days, and people tend to think when they get ill, they think back to whatever is the sort of closest in time to their bout of a violent or difficult illness, and sometimes the memory of water immersion or other water impact can be somewhat long in the past. Also, when medical practitioners try to figure out where diseases come from, it's hard to get accurate exposure history from patients simply because they don't remember or don't think of it or don't think of things like waterborne diseases. And there are many routes of infection that can be from drinking water, recreational waters, swimming pools, water parks, medical or dental devices, and bottled water, a variety of different sources. And sometimes there are co-infections with multiple waterborne pathogens, and this confuses diagnoses, makes it really difficult for medical people to figure out what the actual disease is. Many pathogens aren't really unique to water, but move in food, soil, and air too. Also, some healthy patients may show no symptoms, but vulnerable ones may become seriously ill. And another big reason that waterborne viral illnesses might be grossly underreported is that by the time you get done with the disease, and often they're self-limiting diseases, you've kind of forgotten about it. And what do you want to dig into it for, basically? And underreporting is huge. I mean, statistics on various causes of diseases are collected by governments, but some estimates are that only 1 in every 100 to 1,000 cases of gastroenteritis or acute gastrointestinal disease are reported. So communities may have as many as 35% of people who are infected with a gastroenteritis in a year, but of that 35%, only 11% of them may seek health care. So 1 in 10 may seek health care, the rest may simply self-treat. There are lots of reasons then that people underreport, but basically only 1 in every 100 to 1,000 cases of gastroenteritis, be it caused by waterborne sources or others, is reported to reporting agencies. There are lots of barriers to clinical diagnoses of water-related illness. There are clinical constraints and time restrictions on practicing clinicians that are hugely important. There's a rarity of educational resources for healthcare providers on diagnosing these waterborne diseases. And if one is ever, if you know a healthcare professional, you know that they treat a large number of patients and don't have a lot of time to reflect on all the details of each patient's illness. The objective is find a way to get them well. And also state agencies, my state for example, really relies on self-reporting by people with the illness to know where the illness might have come from. There are also new diagnostic challenges of emerging pathogens, water pollution and other sources. And there are lots of newly emerging waterborne pathogens, like the viruses, that are hard to analyze for. And if we're thinking of chemical causes of waterborne illness, there are probably something like 60,000+ chemicals that are released into water, and maybe 700 or more new ones annually. And the vast majority are never tested for toxicity because perhaps it's not intended that they will be released into water systems. So there are lots of ways of determining what the cost of waterborne illness might be. And this is a table that is taken from a recent publication by Collier and co-workers, and who work with the Centers for Disease Control. And I think one thing you should notice, if you look at the vector column, you'll see that there's really only one virus that's part of this. This is a mechanistic approach where they look at diseases that are commonly monitored and try to determine what fraction of them come from waterborne sources. It's a very interesting study, but they find that in the United States, which has very good water treatment, something like $3.3 billion is spent annually on the medical costs of waterborne disease, ignoring most of the viral diseases, but certainly including a lot of the really important bacterial diseases. The problem with this $3.3 billion number is that it's limited to diseases that are commonly monitored. It ignores almost all viruses except for norovirus. It ignores the effects, the health effects of harmful algal blooms. It ignores virtually all toxic materials. It ignores the total amount of time or wages lost to ill health, disability, early death, or other indirect costs. ignores physician office visits other than those that are in a sort of a hospital environment, underrepresents biofilm harbored illnesses, which are of growing importance, and ignores the value of human life. And actually, this $3.3 billion number includes the effect of swimming pools, and swimming pools are responsible for something just less than about 50% of these overall costs. Another way to look at this is probabilistic, and this has recently been done by DeFlorio Barker and co-workers, who assessed the difference in disease incidence in people engaged in diverse water-related activities and those who do not. And over in that pie chart, you'll see that about 66% of the cases had the cases of waterborne illness in recreational waters, not including swimming pools, were swimming was 66% of the 8.7 million cases per year. Fishing, a surprising number. Motorboating, again, possibly by the formation of aerosols. Canoeing, kayaking, rowing, far less. So what they did is they estimated the attributable risk, that is to say, the difference in incidence of diseases between people who did these activities in surface freshwaters and those who did not. And they looked at respiratory, gastroenteric diseases, eye, ear infections, and skin illness. And they did this by difference. In this one, again, it's unknown how much was viral. That is to say, the etiology was not entirely clear. The question was one of exposure. And the annual cost in the United States is something like $3 billion annually. The total health costs are carved up into a bunch of different areas, but you can see that a lost productivity, emergency room, and doctor visits make up, somewhere in the 20 to 30% range, each one of them, of this $3 billion cost annually for the 8.7 million cases. Prescription medication less, and surprisingly death less too, as well as over-the-counter medication. I think waterborne viruses are worth a closer look. And this comes from the observation that correlations between bacteria counts, that's the common way we look at. I think we look at fecal coliforms and E. coli and other bacteria in water as a way of deciding whether swimming and water contact recreation is safe. And but in recent work, the correlations have been found to be very weak, and in some cases non-existent. The Centers for Disease Control show only 54 waterborne deaths due to viruses due to reporting and diagnostic problems. The CDC also includes only noroviruses, and these are highly infectious for sure, but they're rarely deadly. The CDC databases list about 3,700 deaths in the United States in 2019 from viral illnesses of unknown source. And this includes deaths from viral groups and diseases that are waterborne: coronavirus, adenovirus, enterovirus, the retrovirus, and papillomaviruses, as well as diseases like hepatitis A, viral meningitis, viral carditis, infection of the heart by viruses, viral encephalitis, and conjunctivitis, pink eye, basically. If we try to project what amount of viral illness cost might be, it takes a whole lot of hand-waving to get some sort of estimate. But norovirus alone results in about $54 million cost per year in healthcare costs. CDC's database shows 3,700 deaths annually from waterborne type viral illness of unknown origin. One is unsure of what fraction of those came from waterborne sources, but it's a very efficient transport mechanism. If we take a small number like 10% of these being due to waterborne viruses, and say 90% of them are due to food, air, or soil, that's 370 deaths. For all the waterborne illnesses studied by the CDC in the paper by Collier, the average health cost per death is about $502,000. So if you simply divide the overall health cost by the number of deaths, it's about $500,000 per death in healthcare costs. So the health costs of viral waterborne illness at that 10% level may be something close to $200 million, but who knows? I think this is something we should know something about. And knowing something about the garden variety viral waterborne illnesses is important, but the most important diseases would be novel emergent diseases that we haven't run into yet. So if we look at this as an overall social cost of poor water quality, Walter Dodds' work in 2009 looked at the value of recreation, shore value, endangered species recovery, and drinking water, and found that to be a benefit, or a benefit of about $2.2 billion annually. Of course, in older dollars than we deal with today. There was some work by Costanza back in the late 1990s for a lot of values of ecosystem services, but data were given on sort of lake and river recreational value. And if you reweight this by the proportion of waters in the United States compared to the entire Earth that Costanza was working on, this would come out to be an annual value of about $1.4 billion. In the work that I cited a few minutes ago by DeFlorio Barker and co-workers, waterborne illnesses from recreation and surface waters, not including pools and so on, about 2.9 or about $3 billion annually. Collier and co-workers identified CDC vector illnesses, including surface waters, drinking water, and pools, and came up with a number of about $3.3 billion. And if you assume, make some assumptions about this, that about 40% of that was from natural waters, which is probably a pretty reasonable sort of number. The cost of those vector-driven illnesses, known vector-driven illnesses, is probably something like $1.3 billion annually. And if you want to make a guess at what viral waterborne illness might be by the difference between the DeFlorio, Barker, and Collier surface water estimates, viral illnesses may in fact account for something like $1.6 billion in social cost of poor water quality annually. So it's important for us to figure out what the overall costs are of things like waterborne viral disease, but we've only looked at the top part of this particular figure, and that is the disease part so far. And this is emergency room visits, hospitalizations, lost productivity, and increasingly complex diagnostic pathways, death and lost productivity. But also we should be thinking about other costs of waterborne diseases, like the mental health effects from fear of disease. And these have been looked at by psychiatric scientists very recently. Or maybe, as my tourism friends were concerned, the cost of the avoidance of potential for disease. For example, concerns about COVID-19 cost the tourism industry in Hong Kong $3 billion in 1 year alone through lost commerce, altered spending patterns, purchases of unnecessary materials. Another type of cost that we should be considering is increased costs of sewage handling and treatment if we want to avoid waterborne diseases. Many have shown that viruses, pathogenic viruses, are abundant in sewage when it meets coliform standards set by governments. And this would include increased treatment costs, avoidance of accidental release, the costs of nearly unavoidable leakage. All these systems are very porous. And looking at climate change effects, flooding can release a massive amount of pathogens into water systems and into surface waters, and those should be considered in terms of cost and the avoidance in terms of value. And there are also increased costs of water supply purification. I said a few minutes ago that viral pathogens are sometimes a little more resistant than bacteria are to water purification techniques, which would require costly upgraded technology. And again, trying to figure out how to avoid leakages that are almost impossible to avoid. The work that needs to be done is large if we want to get a good handle on viral and, for that matter, overall impacts of waterborne illness. With respect to disease, we need far better tracking of sources of illness and their vectors. We also need estimates of the cost of unreported or unrealized illness, and have to begin to understand the distribution and abundance in natural systems of viral pathogens. And for this, some of my friends at the medical school at University of Minnesota have suggested perhaps that we use the mild model pepper virus, which exists in all hot sauce and therefore all prepared foods and is a wonderful sewage tracer. Also, the work that needs to be done on mental health effects is to understand the cost of risk aversion on the quality of life and mental health. With respect to avoidance of the potential for disease, we need to understand the cost of waste and of lost opportunities for recreation or other experiences that have to do with water that may be perceived as possibly harboring disease. We also need to begin to think in infrastructure terms about realizing the cost of sewage handling and treatment for more thorough removal of viral contaminants. And we should have concerns and methods in place to avoid accidental release, and especially we need to bear the costs of infrastructure improvement and make our sewage systems resilient to climate change, providing greater engineering margins. And finally, the increased cost of water supply purification will require understanding of the cost and benefits of upgraded technology and trying to reduce what is often thought to be almost unavoidable leakage. My final thoughts on this are a few. All waterborne health impacts are underreported and underidentified, whether they are bacterial, protozoans, chemicals, viruses. We do not track them very effectively in the United States, or for that matter, I'd reckon almost anywhere on the planet. This is especially true for viruses and emerging pathogens that we may not understand terribly well. Right now, we understand that the cost of waterborne illnesses from recreational exposure are likely greater than $3 billion annually, and perhaps the willingness to pay by the public for protection from those illnesses is higher. The last time I had a gastroenteric disease, I have a really high willingness to pay to avoid that kind of thing. And in the case, the big question is, what would be the value of avoiding a novel waterborne virus? What would that be? Right now, the willingness to pay in the United States for reducing the baseline probability of SARS-CoV-2 infection by 90% is somewhere between $8,000 and $28,000 per person. Therefore, population level value of something like $5 trillion. I hope you've enjoyed and learned something from this overall view of waterborne viral particles and waterborne illness in general. I think it's an area that needs monetization and understanding from both the biophysical sciences and the economic sciences. Thanks.